So I'm one of the faculty members at gIDE, and this weekend we had our inaugural soft tissue course. And it was a sold-out course. We talked about all different techniques for soft tissue procedures. We really emphasized how we harvest and how we manage the palate. And we went over the different ways of getting excellent soft tissue coverage around teeth and implants. The course was designed as a 2-day course. The first day we talked about the fundamentals, we talked about how to harvest, and then we had 2 different workshops on harvesting, and we used models that are very realistic. And then we discussed about the various suturing techniques, because one of the hardest parts of soft tissue is how you close everything back up to make it look pristine and beautiful. And that's one area where a lot of us struggle. So we definitely emphasize that, just to make sure that they have all the foundations that they need to take this back to their practice and start doing these procedures Monday morning. That's the whole idea, is that they can take it back to their offices.
Okay, there's 3 areas where tissues bind that you can't corneal advance. And one of the biggest ones are the papilla. So if you don't release your papilla, a lot of times you can get this to come back to here, but this to come up all the way. So releasing of the papillas are very, very important in all kinds of tunneling procedures.
It's been an exceptional group of various levels of experience with surgery, but every single one of them has come up to me and said how much they appreciated it, and it was exactly what they were looking for. So that makes me so happy, because I'm really doing this because I love sharing and I love educating. So I'm super excited, and I think the feedback generally has been very, very positive. And it's been, they say the course was organized. We really taught them what they needed to know. So it's been an amazing experience all around. Because we did a live patient surgery this morning, we can put everything that we talked about into practice, so they can actually see how the surgery is done on a live patient. And I think that is something that most courses don't offer, and that's something that's unique to gIDE. And I think that they really appreciate when they actually see you do it, and see if you're struggling with something, or if something you had success with, using one of the foundational stuff that we talked about in the course, then applying it on the live case. So it makes the whole thing kind of come together really well for them.
Woo! So it actually went a lot easier than I thought, because I was able to get very nice release, and I'm glad I chose the tunneling, because I think had I done the calf or the vestibular, it would have complicated this case even more. So I went with my intuition, and I think I was right.
I think the key thing with being a good surgeon is to be able to problem solve on the fly. And the way you can problem solve on the fly is if you know what solutions are available to you. And I'm hoping that we gave people enough solutions, so if they see various scenarios, they can use one of those solutions to apply it to the case. You can't have just like one tool in your tool belt and try to use that for everything. You gotta have 3 or 4 different toolkits that you can apply. But yeah, you gotta problem solve. You can't just go into every case and expect to do the same thing and get the same results. I think if you're really looking to take your soft tissue skill set to the next level, I highly recommend that you attend one of our courses, because it's very structured, it's not confusing, it breaks it down to simple but actionable steps that you can take to your office and start doing these confidently.